guys, this is a session on pre-anesthetic medications. We'll be studying about the definition, its objectives and aims. Okay, so first is what is the definition of the pre-anesthetic medication? So it is the use of the drug before the administration of anesthetics to make the anesthesia more pleasant and safe for the patient to use that drug. You mainly inject it so that you can make the anesthesia effect safer. What are the uses of the pre-anesthetic medications? So remember the mnemonic A, it's mainly used in anxiety to relieve the stress, it's used in amnesia, it's used as analgesics to relieve the pain, it's used as AntiEmetic, decreases the vomiting, it's also used in acidic gastric problems. Okay, so further moving on to its objectives, remember all these. The first one is it mainly tries to reduce your anxiety. The best drug we can use is benzodiazepines such as diazepam, lorazepam and midazolam. These three are the important drugs. Remember at least diazepam, which mainly reduces anxiety. It has a sedative sleep effect. It is amnestic, that is you forget the things. It gives you the calming anxiety effect. These are the important properties of the diazepam. Second one is it mainly tries to prevent your vagal bradycardia and reduces the salivary secretion which is caused by these anesthetics. So consider any anti-muscarinic agents such as the atropine or the glycopyrrolate. These are usually used to prevent the vagal bradycardia and reduces the salivary secretion. It also tries to decrease your hypotension. It prevents the laryngospasm of the lungs, and it tries to reduce your respiratory secretions. The glycopyrrolate is usually preferred because it's one of the potent and it usually does not produce any CNS adverse effect and it has less tachycardial effects. Okay, these are the two objectives. Moving on to the third objective, that is it mainly tries to relieve the pre and post-operative pains. You can consider mainly the opioid analgesics like the morphine, which is the best example. You can also consider the pethidine and fentanyl. These are also used to relieve pain. Okay, so we know these drugs relieves the pain, but it has a lot of adverse effects, mainly the respiratory depression, hypotension, vomiting, nausea, constipation, biliary spasm, bronchospasm, mainly which is seen in the asthmatic patients. Therefore, it's not usually preferred for those who are suffering from asthma. It can also be combined with the NSAIDs, that is non-steroidal anti-inflammatory drugs, mainly the diclofenac, which can also be used in this condition. It also mainly tries to relieve all the post and pre-operative pains. Okay, the fourth one is the anti-emetic effect. Emetic means vomiting, so it tries to decrease your vomiting. Mainly the domperidone, metclopramide and ondansetron can also be used here, which mainly tries to control your vomiting. But the problem in this is it has a lot of adverse effect. Mainly it causes the acute dystoniasis and extrapyramidal symptoms, which is also known as EPS. These are the main side effects of metoclopramide, and domperidone is also having this effect. But the effects of domperidone is less compared to the metclopramide, whereas ondansetron usually does not have more side effects. The fifth one is it mainly tries to prevent the gastric acid secretion and the stress ulcer. The best tablet is ranitidine and also proton pump inhibitors like the omeprazole. These are the H2 blockers. They can also be used to reduce the gastric acid secretion. They are also used in the pneumonia aspiration, especially before the prolonged surgery. The sixth effect and the last effect is it mainly tries to hasten your gastric emptying time before the emergency surgery. The best tablet is metoclopramide and domperidone can also be used here. These are the prokinetic drugs which mainly tries to increase the tone of the lower esophageal sphincter, and they try to accelerate the gastric emptying time, and thus it prevents the aspiration pneumonia. So this is the sixth point, 5 important point. Okay, let's speak about the summary here. Pre-anesthetic medications, its objective, we know the first, it mainly tries to reduce your anxiety like the benzodiazepines, diazepam. It prevents your vagal bradycardia. It tries to decrease your salivary secretions, and also it tries to relieve your pre and post-operative pain. And anti-emetic effect, it tries to decrease the vomiting, it prevents your acid secretion and stress ulcers. The sixth and the last is it mainly tries to hasten the gastric emptying time before any emergency surgery. So these are the six important points. Remember this. Hope you like the video. Please do like, share, comment and subscribe. Thank you.